Ready to go? Okay. Thank you, Rob. And thanks to the Institute for asking me to give this presentation today. When I was thinking of a topic, I chose this one because I thought of all the places in the world that I could choose to present this particular piece of work for the first time, this is probably the most appropriate, because I know the Institute of Work and Health has a long history of knowledge translation and exchange in practice, and also some research, and particularly in this area of injury compensation systems. So this is the first time I've given this presentation, and I just think this is a really good audience for it. There's probably a lot of people here in the audience who know quite a lot about this topic, so thanks for having me. I'm not quite sure how to describe what it is I'm going to talk to you about. It's sort of a piece of research. It's also a bit of stakeholder engagement. It's a bit of communications and marketing. It's a little bit of everything mixed in together. So I'll let you make up your own minds about what you think it is, and perhaps we can have a conversation at the end about that. And I am hoping to get through this in 30, 35 minutes and leave plenty of time for discussion. It's one of those issues, one of those areas in which discussion is important. For those of you that don't know me, I'm the Chief Research Officer of this Institute for Safety, Compensation and Recovery Research in Melbourne, Monash University. And ISCRR is an organisation that's now 3 years, 2 months and 6 days old. So we're still pretty young. We have a very close relationship with the Workers' Compensation Authority in Victoria and with our Motor Vehicle Accident Compensation Authority in Victoria. And they're our major funders, and we have a sort of integrated governance mechanism where we work very closely with those two organisations and also with the research community through Monash University. So although we're an institute of the university and we do independent research, we have a very, very close relationship with the compensation regulatory authorities in Victoria, and a growing relationship with those authorities in other states of Australia and New Zealand as well. And that's really what led to this piece of work. So there's a lot of people who have been involved in this, and I wanted to spend a bit of time on this group of people, and I want you to try to understand who's really been involved in getting this consensus statement together. It's quite an important principle that we've tried to reflect in every part of the work that I'm about to describe to you. Is this was really a joint effort between the research community and the policy community in the injury compensation sector in Australia and New Zealand. And so the people that were my colleagues on the Australasian Compensation Health Research Forum Program Committee reflect that, and they're a mix of researchers and people from within the various some of the compensation schemes across Australia and New Zealand. So I'll just run through them briefly so you kind of get a feel for who we have here. So Ian Cameron is a sort of senior academic from University of Sydney. Andrew Fronsco is a senior executive responsible for strategy and policy within our Transport Accident Commission in Victoria. Amanda Gray runs the policy and research area for Safe Work Australia, which is the national sort of coordinating agency for workers' compensation and OHS issues in Australia. Chris Latham is a senior partner with PricewaterhouseCoopers. He's an actuary, and actuaries are quite influential in injury compensation schemes in Australia. And he's quite a senior person, well known and well connected. Kath McPherson's a senior rehab physician and researcher from a university in Auckland. Dr. Peter Odges was a researcher, now runs the research and policy areas for Comcare, or research areas for Comcare, which is a national workers' compensation scheme in Australia. John Wren's the principal research advisor to the Accident Compensation Corporation in New Zealand, and Bevan Yee is a senior manager within the strategy and policy area for WorkSafe Victoria. So they're kind of fairly senior executives and senior researchers that we engaged quite specifically to be involved in the program committee of this forum. And I almost, again, this is sort of a quasi-scientific approach that we took to this. I almost, when we were choosing the program committee, sort of stratified the sampling, if you like, to make sure we had representation across policy and research across Australia and New Zealand, and to get the right mix of people on the program committee. And we ended up with quite an active very involved committee, all of you deserve a lot of acknowledgement for what I'm about to talk to you about. And also there were some people within ISCRR, within our research translation and stakeholder engagement area who have contributed to this. Okay, so I'm going to briefly go over something that you're probably familiar with, the use of research evidence in policy. So I'll spend a little bit of time talking about that and give a few examples, mainly from the Australian context. I want to run you through the idea of this forum that we had in Australia last year, and then run you through the consensus method and get into some detail on the statement, and then talk about how what we found in putting this statement together compares with prior research. And then I'm very interested in your ideas of where we might take this next and what we might do now that we have a statement in Australia and New Zealand. So this is an example of some of you may know. It's one that's pretty well known in the KTE area, and I'll just run you through it. In one of the, I guess I think of this as one of the first controlled trials in health. A guy called Captain James Lancaster of the British Navy showed in 1601 that lemon juice can reduce rates of scurvy among sailors. He had 4 ships that he was in control of, and in one of them he administered a few teaspoonfuls of lemon juice to the sailors, and the others he just let them continue with usual care, if you like. And he showed that in the ship that he gave lemon juice to, there was a reduction in rates of scurvy, quite a dramatic reduction in rates of scurvy. 146 years later, Dr. James Lind, who was also of the British Navy, demonstrated that you could treat scurvy using citrus juice. And then it took the British Navy 194 years after this discovery to actually start using citrus juice amongst their sailors. So that's an example of the evidence-practice gap, a pretty dramatic one, if you like, 194 years from discovery to implementation. And then in 1854, the British Board of Trade began using citrus juice for commercial sailors as well, for 253 years after the discovery. And this evidence-practice gap is sometimes called the Valley of Death. And this is just a picture from a commentary that was published in Nature in 2008, talking about what happens to a lot of clinical research where it doesn't make it from the lab into practice. And this particular author, this commentator in Nature, called this gap the Valley of Death. And the quote was something like 95% of research doesn't make it out of the lab and into practice. It falls into the so-called Valley of Death. And that's certainly the case, I think, with a lot of in policy as well. This was talking about translation from lab-based science to clinical science, but to clinical practice, but also relevant to policy. In the same paper, just to touch on this a bit more, the same commentary, the author of this showed that if you look at NIH funding from 1970 through to 2005, the number of clinicians involved in research as a proportion of the total number of people leading research projects has reduced dramatically. So although clinicians leading research has increased over time, the number of PhDs leading research has increased at a much greater rate. So the implication being that clinicians are in a much better position to take research and apply it in practice, given that they're clinician researchers, than people with PhDs who don't operate in a clinical environment. So it's an interesting article if you get a chance to read it that talks about this clinical practice gap. So in policy, there's similar evidence around. So we know there's 1 or 2 papers that suggest that between 8 and 15% of research evidence actually gets used to affect a change in policy or practice. We've recently shown in Victoria, and I'll show a little bit more about this in a second, that in injury compensation, about 2.1% of all references to things in injury compensation treatment policies were references to academic pieces of research. And so that means that 98% of references to evidence, the broad categorisation of evidence, were things other than academic research. And this is my favourite quote from an article that you sent me, actually, Ron, I think, in Canadian Policy Workers. It's a qualitative article amongst Canadian health policy workers, I think, about their attitudes towards the use of research evidence. And this was actually the title of the article. It's a field. That's what a lot of our evidence would consist of. Sort of demonstrating some of the issues we have with getting evidence used in policy. In Australia, and I'm not sure if this is the same in Canada, but in Australia from the 80s onwards there was a real change in the way that government and public policy operated, described in a sort of a public a document from the APS, the Australian Public Service, written by McDermott. There is greater emphasis on constraining the cost of government and on outsourcing and privatisation of some skills, deregulation, if you like. So we deregulated the transport sector and some aspects of other sectors as well. And probably the clearest example of this, the most relevant example of this I can give you is that this paper describes the move from policy expertise from within departments to within ministerial offices in Australia. So the policy making components of government, the expertise that was previously in those moved across to the sort of political arm of government in ministerial departments. Gary Banks in Australia used to be the chair of what's called our Productivity Commission, which is the government agency responsible for doing major public investigations into new public policy proposals. After he retired from that position, he was asked by the Australian Public Services Commission to review the capacity for use of research evidence in Australian public policy environments, and he concluded that training and skills and the capacity for use of evidence amongst policy workers in Australia was actually quite limited. And he runs through quite a damning list of things that have occurred in the Australian public sector over the last 10 or 20 years to result in this situation. The exception is in the Department of Treasury and Finance, where the ability to do research, economic research, is still maintained, but in other sort of social government departments, if you like, the capacity for using evidence has declined pretty substantially over the last 30 years in Australia. So this is sort of the macro environment that we're operating in Australia. There are a couple of published research papers that look at use of research evidence in Australian public health policy. One from drug policy workers in New South Wales, it was published in 2009. And one of the things it did was ask them about the sources of evidence they used in their day-to-day work. And these are in order, and most notably for the presentation I'm about to get into, academic research evidence is sort of down the bottom of the rung here. So they're much likely to use more likely to use the internet, speak to experts, look at technical reports, talk to their counterparts in other jurisdictions, and they are to use academic research evidence. Academic research is above a few other things as well, interestingly including internal expertise, which is surprising to me. And there was also a study in New South Wales health policy workers, which identified some of the most common reasons for not using academic research evidence, and you may not be able to see that up the back. In New South Wales public health policy workers, the most common reason for not using academic research evidence was lack of skills or capacity to access or acquire appropriate research. So lack of skills and lack of capacity to get access to research. So these are the two papers I've been able to find in Australian public policy workers that speak to what public policy workers think about academic research evidence. This is a piece of work we've just submitted for publication where we did a content analysis of treatment payment policies of our Motor Vehicle Accident Compensation Authority in Victoria, and we looked for different types of evidence in those treatment payment policies, and we counted the frequency of references to evidence and the number of policies out of 128 that were publicly available that referred to different types of evidence, and the least referenced type of evidence was academic or scientific research. So, yeah.
Your analysis, so was it taking formal citations?
Yes. Yeah. And so these references were things like, actually that's not true. Some of them were citations, and some of them were comments like, you need to, in order to make a treatment payment decision for this particular condition or disease, you need to refer to the best available medical evidence or a recent academic paper. So it was quite a broad categorisation of references to academic evidence. And there are actually, from memory, only 7 or 8 references to specific pieces of research out of the 128 policies that we saw. So very low use of or references to academic. It doesn't mean policymakers don't use research evidence to formulate policy. It just means in the published documents they very rarely refer to it, at least in this case. So that's all background to why we did this piece of work. So ISCRR's been going at the start of last year when we decided to have a conference, to host a conference with the Accident Compensation Corporation. We'd been operating for under 2 years. We were operating in this environment where we thought there was a real need to have a dialogue between policymakers and academics about what factors influence the use of research evidence in policy settings, and particularly injury compensation policy settings, and not just focusing on why policymakers do or don't use evidence, but also focusing on what academics can do to increase the use of evidence in policy settings as well. So the objectives of this, if you think of it as a piece of research, were to influence, so regarding the factors that influence use of academic research evidence in personal injury compensation policy environments in Australia and New Zealand, to develop a consensus statement amongst the sector in Australia, and really it was an awareness-raising piece of work, if you like, to try to get the sector familiar with all of these issues that we were encountering. So that's by way of background, and then we decided really in about October, November 2010, after a visit from our colleagues from the Accident Compensation Corporation New Zealand, to host a conference where we got, the intention was to get academic researchers together with policymakers to in the same room or the same rooms for a couple of days to talk about research evidence that was relevant for compensation policy, and to talk about barriers and facilitators to using research evidence that was in policy. The theme of the conference that we came up with was research to action, and we really started planning it in earnest probably February, March 2011. The aims of the conference were twofold: to assist in translating knowledge between compensation health researchers and personal injury compensation regulators and policymakers, and to improve the capacity within the field of compensation, what we labelled the field of compensation health research. As I mentioned, the intended audience for the forum were compensation policymakers and health researchers, and we targeted the marketing of the forum specifically at those sort of two groups of interest. We did get a few other people coming along that work in this area, and I was for my sins, I was asked to chair the organising committee and the program committee of this, so I was heavily involved in it for the entire period of last year. And we organised the program such that it was really about providing opportunities for interaction. It wasn't really a program where a bunch of people got up and gave presentations and then there was very little opportunity for discussion. What we tried to do was have sessions where we'd have a couple of presenters and then 30 or 40 minutes for discussion about a topic. We had a debate where we got about the role of legal practitioners in injury compensation settings, which was very interactive. We got the whole audience, the whole participation, all of the participants engaged in the forum. We had some keynotes that were followed by sort of long panel sessions and discussions, and we tried to make the program as interactive as possible to try to maximise that interaction between policy workers and researchers. So the whole emphasis was on engagement and interaction throughout the forum. And on the second day, we had a session on a roundtable session, which I'll describe in a minute, which was the basis for this consensus statement. Being the person that was sort of responsible for it last year, I didn't want to just have a forum and leave it at that. I wanted there to be some sort of legacy, some sort of enduring something that came out of the forum. And a few months before we had it, we sort of hit on the idea of trying to get some sort of consensus statement on the use of research evidence in policy. And that's really what's led to what you're about to hear. This is a breakdown of who attended. We had about 120 people. We were trying to limit the numbers to 100 to keep it sort of intimate. we ended up having to expand it a little bit. We turned away about 30 or 40 other people because the venue we chose just couldn't contain them. So it was quite successful. The marketing for the forum was quite successful. About half of those people were policy workers, about 33 researchers, and then a smattering of other people from our private insurance sector, some consultants, a few actuaries, a few healthcare providers, some lawyers, and one sole community representative. The majority of people came from Victoria. The conference was held in Melbourne, and really most of those people were from our research networks and from our partner organisations who we work pretty closely with. We did get pretty good representation from the other major jurisdictions in our space, so the eastern seaboard of Australia, New South Wales and Queensland, and from New Zealand. Less involvement from some of the smaller states in Australia. Importantly, the type of people that came, they were very influential. So in Tasmania, the sole representative from Tasmania was the CEO of the Motor Accident Insurance Board down there, so a pretty important person. In South Australia, we had the executive in charge of compensation policy from the workers' compensation sector. Same equivalent person from Western Australia. And so although the numbers from some of these other states were small, we actually had some very influential people around the table. I think we had representation from 13 of the 20 different injury compensation systems in Australia and New Zealand. And pretty much all of the major research groups were represented. So ourselves at ISCRR, there's two other equivalent sort of research groups in Queensland and in New South Wales, and some of the major research groups in New Zealand as well. So we had a pretty good coverage of the people who are actively involved and the decision makers in the area. This is the process that we ran through to get a consensus statement, and I'll just briefly go through this. So we had we sent a letter out about a month before, well, a couple of weeks before the conference, telling people that what we're intending to do in this 2-hour session where we had this roundtable, saying it's going to be about translation of research evidence into policy. Here's a bit of information for you to read before you come and think about it. And then on the second day of the forum, we had this 2-hour roundtable discussion that engaged everyone that attended. And then we'll describe the data analysis that we did after that to produce the first statement. Then we had a second round of online consultation, which was open to everyone that had registered for the forum. Which led to an iterative sort of development of a second draft statement in late January this year. And then that second draft statement was considered by the program committee, which was, as I mentioned before, reasonably representative of the different groups across the country, and they made some more modifications which produced a final statement, which I'm going to show you. And then for the last couple of months we've been going out and attempting to get organisational and individual level endorsement of that statement. So I'll tell you mainly about what we did here on the roundtable discussion, and then I want to actually sort of focus on the statement as well. But essentially this was sort of a quasi sort of Delphi method where we went through an iterative series of consultations with a sort of gradually smaller group of people until we got to the final statement. That's the process that we used to get consensus. So the roundtable discussion at the forum was over 2 hours. It was on the second day, so people had had a day and a half of exposure to research, exposure to policy, a couple of presentations on use of research evidence in policy, so they should have been thinking about these issues for a day and a half prior to this session. We hired a pretty amazing facilitator who led it. We broke the group up into 15 tables of 6 to 8 participants with one scribe per table, and we had a series of 5 10 to 15 minute discussions, each addressing a single question, which I'll run through in a second. And after each discussion, information was fed back to the facilitator, who mapped it in a dynamic way on an overhead projector. And we moved table membership around twice during the session so that the groups didn't get into sort of groupthink. We wanted people to be exposed to different groups of people as they were coming up with these ideas. And so essentially what happened in each one of those shuttles was that 50% of members on each table were asked to go and sit at another table, which was logistically challenging in a 2-hour session. And the output we got were the notes from the scribes and the mind maps developed by the facilitator. The table level notes ended up being 50 or 60 pages of documentation. That was quite a lot of material to work with. And we did a sort of content analysis that was led to the basis for the statement. questions that we asked in each of those 5 sessions were, first of all, sort of a warm-up question: what do you hope will be achieved in this session? Which had some interesting stuff. I won't really report the results of that. And then really what I want to focus on are the second, third and fourth questions. So from your knowledge and experience, what are the main issues in using research evidence in compensation settings? And that brought forth a whole range of different things. And then focusing a bit more on what are the barriers to successful translation of evidence into research and policy, and what are the opportunities for successful translation of research into policy. And then at the end we asked, we're intending to develop a consensus statement. What are the absolutely critical things that should be in the consensus statement from your point of view? This is an example of the mind map that was produced by the facilitator, and it was done in a very dynamic way. It had a person sitting on the side of the session sort of typing in this information as the feedback was being given, and it got added to as the feedback was being given. It kind of gives you a hint of some of the key issues that were coming out. So communication is a big issue. Funding of research and who does it, who funds translation activities. Timing is one that I'll show you is a pretty significant issue, and a relationship between researchers and users. And this was really just a way of sort of harnessing the conversation and making it a bit more meaningful on the day. Really what we focused on was the table level notes in order to produce a draft of the consensus statement. And this is where some sort of research methods again came in. So we got 2 raters, myself and one of the other members of the program committee, independently identified themes based on a fairly broad search of concepts emerging from those discussion notes that were transcribed at the table. And we compared themes and developed an agreed set of themes that were coming out of the notes. And then we attributed individual level comments on those table notes to each theme, and then looked at fragments of text to try to come up with sub-themes within each one of those, and tried to agree on those sub-themes, and then looked across the themes to identify similarities and differences where they would occur, and tried to collapse themes where we could and sub-themes where we could, and then eventually ended up with what we thought was a reasonable set of themes and sub-themes that came out of the table level notes. And here's what they are in a nutshell. But I'm going to go through these in a little bit more detail, so I won't focus on them just now. And I've mentioned this briefly. Once we had the draft statement, we went through this period of consultation and revision. We made it available online. We got a relatively small number of comments back from the online, but they were very detailed comments, mainly about the content, the format, and the language. And we updated it, sent to the program committee. We got some more feedback some more comments back from the program committee, and now it's on our website, on the forum's website, and we're looking for endorsement. Here is a copy of it, the front page of it. And I'm going to take you through each of the sort of key points of the statement. But I think the sort of precursor statements to it are quite important. So I'll read them if you don't mind. So this consensus statement is motivated by the observation that compensation can have a significant impact on the health and well-being of injured persons. A major challenge facing compensation research is to understand the reasons for this effect and to improve the design and practice of compensation systems. The consensus statement emerged from discussions held at the First Australian Compensation Health Research Forum. The forum concluded that evidence to inform policy and practice can improve the well-being of injured persons and maintain the financial viability of compensation schemes. And then I think this is probably the most important paragraph, precursing paragraph. It says, realising the benefits of evidence-informed policy and practice requires a shift in thinking and practice. It requires cooperation between compensation authorities and research organisations, and the involvement of many stakeholders, including government, the medical and health professions, advocacy groups, employers, legal practitioners, private sector insurers, and claims management organisations. And every word in this statement has been sort of poured over so that we don't offend anyone in the process of putting it together, really, and we try to capture everyone's view. So it's quite, I think those sort of preceding paragraphs are quite important. It then goes on to describe the issues that were observed in the statement. I wanted to take you through each one of those. I'll do it quickly because
So Alex, before you do that, it's interesting that you targeted injured workers, but you didn't include injured workers. Was that purposeful? The impact of all of this is about really improving their health and well-being of a certain constituency, but that constituency wasn't part of the framing of this. Have you got any feedback from that?
No, we haven't. It wasn't so much about, the end goal is to improve the health and well-being of the workers, but the purpose of this was really to say, how can we get research evidence used in compensation?
But you didn't see them as an advocate group that would be helpful to that?
We had, in hindsight, yes, no, you mentioned they probably are. We include advocacy groups in here, in the statement. We only had one community representative, which was a representative of an injured worker group at that forum. So there's probably a gap in this now that you pointed out. Yeah.
No,
thanks for that. But no, you're right. Okay, so first issue was about relevance, and I'm sort of paraphrasing the text in the consensus statement here to make it a bit more meaningful, and just to get to the point really. So essentially, the statement says policy relevant research is more likely to be adopted by policymakers, and meaningful engagement between policymakers and researchers throughout the research process is a way of developing policy relevant research. And this was these are some of the transcribed notes that came about on the table that sort of give you an example of the types of comments that led to this particular thing being in the statement. So findings are not always relevant, not implementable. How do I, as a policymaker, get information that I can use and I can trust? Issues about co-location of research and policy and having the same accountability. Lack of clarity around the intent of why research is being done. These sorts of things fed into this broad theme of relevance. I'm going to whip through these because I want to have some time to discuss them, and you can read them in the statement as well. Timeliness was another big issue. And this is not so much about getting research done quickly, it's actually more about aligning policy timeframes with research timeframes. So the general consensus was that policy workers tend to operate on much shorter timeframes than most academics. And that was the recognition of that in the statement, and aligning those where we can would lead to increased uptake of research. So these were some of the comments that came about, including sort of a speed dating model. Timeliness of research, making sure that there was a big push from the policy community to make research should be short, sharp and relevant, and the contrasting push from the research community, we need to do rigorous academic research to give you the best outcome. So finding the right balance there is obviously important. Communication was constantly discussed, and really about the clarity of communication, and about research communications having actionable messages that and also that researchers should indicate their level of confidence in their findings. So if you're doing something short and sharp for a policy community, you may have, in some cases, you may have less confidence in those findings than if you had time to do a more rigorous, methodologically rigorous piece of research. And far and away the most effective, or the preferred communication mode was face-to-face communication, not through reports and those sorts of things. And some comments that just sort of represent that theme. Access, and this was an issue mainly for policymakers, so getting access to research and to researchers was another theme that came through, and the recognition that there were functional and structural barriers to accessing research for policy workers. Not knowing who to speak to, having access to research libraries, and having the sort of lack of skills or experience to interpret research and know what to do with it. And some potential solutions were given as well as the knowledge broker idea, issues about lack of access to databases of information, and developing a sort of a pool or a clearinghouse of research that could be used by policymakers. The policy environment, and this was really, really fascinating. Recognition of the complexity of injury compensation systems, and that research needs to influence multiple stakeholders, not only within the compensation policy world, but also stakeholders have an impact on that, like employers and union groups and the like. And the strong potential impact of political and stakeholder interest within working within a compensation environment. And the quote that I like the most here is this sort of hidden stakeholder, which is someone who you weren't aware that you should have been talking to when you were designing or developing or delivering your research results, who ends up being quite a powerful person who says, we're not going to believe that, we'll do something else. So I've personally had an experience where there's been a hidden stakeholder that I wasn't aware of which led to some research not being used as effectively as it could have. That was an interesting thing. And some other similar quotes that are linked to that theme. Culture and language, this is another a very obvious one. So the two environments are quite different. Compensation policy workers and researchers each have different languages, terminology, jargon, which impede even simple communication in some instances. And also the motivations and skill sets of policymakers and researchers are quite different. The drivers for behaviour in each of these two jurisdictions are quite different. And getting alignment of those can be difficult. And some discussion around developing a shared language and understanding, and really about not really understanding each other's context being an issue. Quality, this is quite a contentious one. This particular area probably received the most input when we made the draft statement available online. There was a lot of confusion about what we meant when we said we used the term quality, and it wasn't intended to be a statement about that some research is of greater or lesser quality than others. Some researchers who viewed the statement thought that what we were saying was that epidemiological research was of greater quality than other research. We weren't intending to say that. What we're intending to say is that we had to clarify this language quite a lot in the revised statement, which is that quality and methodological rigour of research needs to be appropriate to the policy issue being investigated. And so you need to design your research for the issue that you're addressing. And we're not saying one type of research is better or worse than another, it just has to be appropriate for the issue that you're addressing. And recognition that some policy issues require quite intensive, detailed studies, while others might require, due to time constraints or other sort of things, might require to be a bit more pragmatic and turn things around a bit more quickly. So it's quite related in some ways to the timing issue as well. There's a lot of discussion, mainly around this idea of research being fit for purpose. So quite a strong thought from the policy community that we should do research that gives the policy workers enough information to make a decision and stop there. And of course the contrasting view from academics is we want to understand these issues in detail, perhaps in more detail than you might need to understand them in order to make a policy decision. So that was the thing that sort of needed to be balanced here. And the final one was about incentives for translation, and this really relates to the academic environments. And it's a familiar story for those that are involved in academic environments, is that we're incented to produce output and to get grant income and to do those other things that academics do. We're not incented to do translation. There's really no, I don't have a KPI at Monash University for me doing translation. I don't get incentivised to do that. And so that was really what came from the academic group. No funding for translation really is the obvious example there. And then the statement also produced a few opportunities to improve use of evidence in policy. I guess I would have liked these to be stronger, but when you're trying to get 120 people from a diverse community to agree on a set of opportunities, inevitably you sort of have to agree on things that are palatable to everyone. So this is what we ended up with. Improving coordination of research efforts and research collaboration across jurisdictions, improving engagement between compensation researchers and policymakers, like through some of the things that we're doing with ISCRR now, some engagement approaches that we're attempting to describe if people are interested. To develop or enhance research translation expertise within compensation authorities, to do research on effective methods of translating evidence within this sector, to make better use of organisations like the Institute of Work and Health, of international research and expertise in compensation, health and practice, so not reinventing the wheel, and to try to improve the understanding of compensation policy environments amongst the research community. So they're not an incredibly aggressive set of opportunities, but they're sort of the things that we could all agree on as a first pass. So what I just described to you is sort of a summary of the final statement, which has gone online now, and we've received already a bunch of organisations and individuals within this sector with written endorsement from those organisations. So just last week I got a letter from the CEO of the Transport Accident Commission in Victoria saying, yes, we're happy to endorse this as the compensation authority for the state, and I've got a few other similar things, and it seems as though it's got some legs. So we've got some buy-in from the sector, from both the research community and the policy-making community in Australia and New Zealand, and that's obviously going to require us to follow through quite strongly on this. When you compare what we found to what others have found in literature, it's quite similar. So this is a systematic review published by Mitten back in 2007, who looked at barriers and facilitators to knowledge translation in policy, in health policy, and essentially described some very similar barriers and facilitators to those that we observed through this process. And also when looking at key strategies to improve knowledge translation, identified some quite similar ones. So what we found in our particular context is very similar to what's been found in other systematic reviews. And there are other systematic reviews, there's quite a few that have been published. Here's just a couple of others that have again also found quite similar results to what we observed in Victoria in a particular context. So to some extent what we observed was not really that surprising. It just repeats the findings of these other researchers. Just very quickly, we've followed this up. Concurrent to doing this, we've been doing a qualitative study of injury compensation policy workers in Victoria and asking them about how they use research evidence and what they think of using research evidence. And this is just a really early breakdown of the issues that are coming out under each of the sort of sets of questions that we asked them. And so I just draw your attention to this communication of research evidence. The sorts of things that are coming through here from policy workers are very similar to what we observed in this sort of consensus process that I just described to you. So face-to-face communication, short, fast, simple messages, the importance of different tools to communicate research evidence, making sure your recommendations actually can result in some sort of action on behalf of the policymaker, and having processes for sharing information between research and policymakers. So we're finding the same things again in a qualitative study focused on Victoria that we're preparing for publication. So in summary, it was an interesting sort of experience, very different to any other piece of research, if you want to call it that I've been involved in the past. And I guess the most pleasing thing with this was that we were actually able to get to some sort of consensus, and it did, at least anecdotally at the moment, raise the level of awareness of these issues amongst this community in Australia and New Zealand. So for that reason alone, I think it was an important exercise. And now I have conversations with people in Queensland and New Zealand and New South Wales about barriers and facilitators to using research evidence, whereas 2 years ago I wasn't having those conversations. So for that purpose alone, it's actually been quite a useful exercise from ISCRR's point of view. It's incredibly hard work. If I counted the number of person hours that went into this, it would be thousands, including all the contributions from the people that contributed to the consensus statement at the forum and all the work that's gone into it afterwards. And the things that we identified aren't really that surprising. They're consistent with prior research. And we're now really trying to figure out what we do with this. What are the next steps now that we have a consensus statement? How do we follow through and take the next step with this? And I have no real clarity about what that might look like at the moment. If you want a copy of it, you can get it from two websites. This is the website for the 2012 forum, which is in Auckland in New Zealand, our second compensation health research forum. And you can also get it from ISCRR's website. As I mentioned, we're getting some endorsement already, and again, I've been asked to chair the program committee for this second forum in Auckland, and one of the things we're going to be doing is having a session specifically about models of interaction between researchers and policymakers. To try, as an effort, to try to follow on from this. So thank you.